So, what are the top 5 facts about monkeypox that everybody should know? So, the first thing to know is that monkeypox used to be considered an illness that was only seen in Africa. That's clearly no longer the case. We're seeing a worldwide outbreak that theoretically could affect many different types of people. So, it's not an African disease. That's the first issue. It's also not a gay disease. That's partly what's been in the media, for example, that this is something that we only see in men who have sex with men, or sort of the assumption that it's a sexually transmitted disease in that setting. And that's not the case whatsoever at this time. So it's not an African disease. It's not just a gay disease. You know, the way we say it is it's an infectious disease. So that's the third point. It can be infectious to others. When we're talking about infectious to others, it's, you know, we've been living through the COVID pandemic. We know sort of what are the ways things can transmit. It could be from a person coughing or sick around you, or it could be from skin to skin contact, sharing bed linens, or with a partner, for example, or multiple partners. So we, at this point in the COVID pandemic, certainly know how to hopefully prevent certain things like that. So that might require wearing a mask around somebody that's coughing that we don't know why. It might require isolating within the home for some time until we have an idea of what's happening. Last 2 things are monkeypox can hopefully be prevented with vaccination. Vaccination is super important and plays a role to try to prevent the spread of infectious disease. And then the last thing I would say is this is the type of infection that, in general, a vast majority of us are not going to necessarily run into or run across. But if there's a situation, if there's a question, this is where your local infectious disease doctor really should be involved. So if your doctor doesn't know the answer or doesn't know what to do, that's the time to sort of either seek out infectious disease input, or have the doctor touch base with the infectious disease doctor that they know, so that we can get the right information, the right test, potentially the right treatment, and the right guidance.